welcome to Mom's Diary. This channel would mainly be about pregnancy, lifestyle, and parenthood. Staying healthy during pregnancy is critical for both the mother and the fetus in order to deliver a healthy baby. But there are some pregnancy signs that, if they appear, immediate medical attention is required because they could endanger the safety of both mother and the fetus. These are the signs that you need to watch out for. 1. Early contractions at the beginning of the third trimester. Early contractions could be a sign of premature delivery. Many new mothers who is having their first pregnancy will be confused about how to differentiate between a real and a fake contraction. A false contraction is medically called Braxton Hicks contractions. Its characteristics are: it could not be predicted, it's not in rhyme, and its intensity won't increase. If you feel a contraction during your third trimester, it's best to consult a doctor. If the birth is considered early, the doctor might be able to prevent a premature delivery. 2. Persistent pain in the lower back. Most pregnant mothers will feel lower back pain during certain phases of pregnancy. However, if the condition persists, it is best to see a doctor to rule out a kidney or bladder infection. Persistent lower back pain could also indicate a premature delivery. 3. Vaginal hemorrhage bleeding. Some bleeding during the early trimester could indicate that implantation has occurred, but if the bleeding continues, then it's best to consult a doctor. If the bleeding occurs during the first trimester, then this could indicate an ectopic pregnancy or miscarriage. 4. Little to no fetal movement. While the fetus is in the womb, it will often conduct some movement. But if the baby suddenly only moves a little or even does not move at all, then the mother should be worried. A fetus with little movement could mean the fetus is not in a good condition or is being constructed. According to the American Congress of Gynecologists and Obstetricians, a pregnant mother must count how long the fetus takes to do 10 kicks in less than 2 hours. If there is a drastic decrease in the number of kicks, or the fetus requires more than 2 hours doing 10 kicks, the mother should consult a doctor. 5. Headache and blurry vision. If the mother is experiencing headache and hazy vision, it could indicate the mother is experiencing preeclampsia. This usually occurs when the pregnancy has entered the 20-month mark with a high blood pressure and proteins detected in the mother's urine. If preeclampsia is not treated, it could cause serious complications. This is very dangerous for both mother and baby. 6. Severe morning sickness. If the mother is experiencing nausea and vomiting or severe morning sickness non-stop for the first 3 months of the pregnancy, this could risk the mother being dehydrated and losing her body weight. If that happens, it could lead to the mother and baby to not have enough nutrition, in addition to imbalanced minerals, and the body nutrients would be imbalanced. 7. Premature rupture of membrane. If the mother's water broke earlier than they expected due that, she needs to immediately be brought to a hospital and receive immediate treatment and examination. A premature rupture of membrane could lead to a premature delivery and significant rates of infection. Sometimes leaking urine from the bladder could also be misinterpreted as a leaking amniotic fluid. Doctors usually will test the fluid to find its source. So, if you want to know some tips and tricks or maybe even some useful stuff to know, subscribe to our channel.